So welcome to a very fun and engaging conversation. My name is Charlene LePane, and I am a gastroenterologist and a Chief Medical Information Officer at Advent Health in Orlando. And I am also so proud to represent the ACOI and give you some information that I think you'll find quite useful on artificial intelligence, talking specifically about medicine and how we can leverage some of these AI tools to keep our patients safe. I have no disclosures. So before we delve into this, let's talk about a few definitions. Artificial intelligence. You probably know what this means, but I'll just recap it for you. It is a field of science that's concerned with building computers and machines that can actually reason with us. They can learn and really act in a way that would really kind of mimic human intelligence. And it involves data that scale exceeds what humans can actually analyze. The term artificial intelligence was coined in 1956 by a guy named John McCarthy. Now, machine learning is actually a branch of artificial intelligence, and it uses computer science with a focus on the use of data and algorithms to actually imitate the way we learn, gradually improving its accuracy the more that we use it. Deep learning is a method in AI. It's a subset of machine learning that actually teaches the computers how to process the data in a way that's inspired by our brains and how we think. And the last definition is NLP, natural language processing. And that's a machine learning technology that actually gives computers the ability to interpret, to manipulate, and comprehend what we say. So let's put it all together because all of these terms can be a bit confusing. So artificial intelligence, think of that as the big umbrella. It's any technique that enables the computers to mimic our intelligence, the way that we think, the way that we solve problems, the way that we understand a language. Machine learning sits under AI. It's a subset of AI. And that's a way to achieve artificial intelligence where systems learn from the data instead of being explicitly programmed like a computer would be. So they learn from the data that we feed it. And examples here would be learning to recognize spam emails by seeing many examples, and that's how it automates spam to go into the junk mail. Now, deep learning, again, is a subset of machine learning. Remember, machine learning is a subset of AI, so we're going deeper, and hence the name deep. It's a more advanced type of machine learning, and it uses neural networks, much like our brain, in many layers, and that's why we call it deep. Think of these as the neurons of the brain. It's especially good for complex tasks like image recognition and speech. And then last is NLP. So that's a subset of AI, and that's often powered by machine learning and deep learning. It's the part of AI that's focused on understanding and generating human language, either text or speech. Think of tools like chatbots, translation, and voice assistants. They all fall here. So summarizing, artificial intelligence is the umbrella, machine learning sits underneath, deep learning is the deepest layer. And then NLP sits under AI, and it often uses both machine and deep learning to work. So AI is the big goal. Machine learning is how machines learn. Deep learning is a powerful type of machine learning, and NLP is the part of AI that deals with language. So now you've got all of those summarized in your brain, and you should have no problems thinking what they do and how they fit into each other, because it can be confusing when you're hearing them and you don't understand the context of where they sit. So we've crossed over some definitions. Let's focus on today's talk. So I really want to explore the landscape of medicine today, how it's AI-driven evolution, and looking at our future trajectory in medicine using AI and other tools. So artificial intelligence applications specifically in healthcare can range from improving diagnostic accuracy and predicting outcomes of our patients, and it can also help us personalize treatment plans, which obviously will enhance operational efficiency and patient outcomes. It can assist in analyzing medical images, predicting disease progression, and automating routine administrative tasks, which clearly take a large portion of our time as physicians. So we definitely want to leverage AI to help in that fashion. In clinical practice, artificial intelligence can support decision-making by providing physicians with evidence-based recommendations and insights derived from large data sets. There's a couple applications, we'll talk through those in a little bit on how we can leverage those. But ultimately, this can lead to more accurate diagnoses and improve patient outcomes because it offers better treatment plans and decision-making processes that are backed up by evidence-based data and our guidelines. So overall, artificial intelligence in healthcare absolutely holds a promise of enhancing the quality of care, increasing efficiency, which is something that we definitely need to minimize burnout. It reduces costs to facilities and to patients, and ultimately leads to better health outcomes for our patients. So you're probably saying, well, why is that so important? It is incredibly important. Specifically, I will focus on efficiency. The reason it's so important is that we have a problem in this country, but really globally, that we are seeing a decreasing workforce and an increasing health demand. So you look at the US population change by age, and you can see the largest growth is that of patients greater than 65. So we have more patients aging, right? The problem is the supply and demand doesn't match. So we have a demand with a larger population of patients over 65, and our supply to offer our resources of physicians is shrinking. So 9.8% of physicians stopped practicing. This is last year, and 7.8% started practicing. So in doing the math, we already have a net reduction by -2% in our physician workforce. So the reason I put this here is because the time has come for us to work smarter and not harder. We have to leverage tools to reach patients in ways that we can't do physically. So leveraging telemedicine, smart room data, doing hospital at home, using AI to automate, diagnoses to help, to use all the platforms I'll talk about. You can use open evidence and help drive decision-making processes much quicker, so that you can actually see more patients in the hospital and or in the office. So that is the focus of this conversation today, to not win you over and let you know that artificial intelligence is going to replace your job. That's not it at all. It's about you as a physician absolutely having to embrace artificial intelligence, to leverage those tools so that you can be a very successful physician and outreach to patients that need to be cared for. So the physician shortage is expected to exceed 104,000 in this country by 2030. So that is exactly why I wanted to talk about this today. Okay, so the adoption and role of artificial intelligence. This is how we keep our patients safe. First, I'll tell you, in 2024, 86% of medical professionals are already using AI tools. So I'm sure you already are. 60% recognize AI's ability to detect patterns and diagnoses that are beyond our human capabilities. It's not that they're smarter than us. It is that artificial intelligence coupled with the way that we think exceeds the way that we think alone. Over 340 FDA-approved AI tools assist in detecting conditions like tumors and strokes. This is clearly the field that has advanced profoundly in artificial intelligence is in radiology. The way that these tools work is that they really improve the speed and accuracy of detecting lesions while maintaining human oversight. So radiology started this trend, and they are moving in a very quick fashion. Other subspecialties are following behind. You can use artificial intelligence as a medical scribe. We use Microsoft DAX in our hospital, which is absolutely amazing. You put your phone down, you get a consent verbally from the patient. I put my phone down, I have a conversation with my patient, and the ambient technology in DAX will filter out all the background noise and just listen to my conversation with the patient. And when I am done with my conversation, when I go through my assessment, I will essentially call out loud, I see that you are coming forth with a cough for 3 days. It's productive. My thought is that, in the presence of a low-grade fever, you likely have a bronchitis. I'm going to prescribe, this antibiotic. Let's get a chest X-ray. Within about 30 seconds, when I'm done and I stop recording, that note automatically populates, and we use Epic in our facility, would automatically populate my note. And the human must stay in the loop. I have to review that and authorize it before I sign it, but my note is complete. I don't have to take my laptop home and complete notes like I used to when I was doing M-modal dictation. We used Athena at that time. So The technology has advanced so much that I am off my keyboard and I am looking at my patient, maintaining eye contact, which obviously shows that I'm engaged. And it's less prone to errors because when I'm doing a free type, a shorthand documentation, I'm trying to capture what the patient is saying. I'm not looking at the patient. I'm capturing quick notes on my keyboard. I'm missing things. Today, I don't have to worry about that because everything that I'm stating in that conversation will automatically populate in my note. I have the option to revise it, of course, before I sign it. But it is such an efficient tool that, again, I am done. My notes are closed out by the time I leave the office, which is absolutely fantastic. So if you haven't used anything like this yet, I'm fairly certain you will when you start practicing. But if you're in a facility and they don't have anything like this, you should ask for it. It's a game changer for physicians. There are also AI applications for clinical decision support. These are great. They help drive alerts and reminders and recommendations that really support effective patient care. So for us, an example in Epic, there'll be like a sepsis bundle. If somebody's coming in and they've got, fever, tachycardic, the low blood pressure, sepsis panel will open up, automatically reminding you that this patient potentially has sepsis. That's the kind of stuff that is absolutely amazing because that is an opportunity that I don't want to miss, diagnosing somebody who may spiral the drain soon. So a great area here. Also remote patient monitoring. I briefly mentioned that, but this allows patients to go home and wear a device that will enable early detection. So for instance, somebody with a brittle diabetic, we can have that monitoring system on them at home so that when I'm seeing somebody's blood sugar consistently 300s, we can adjust their insulin so that they don't have to come in. We can automatically do that. Same thing with congestive heart failure, having somebody, routinely stepping on their scale. We see their weights. If I see that they've got some increased weight over the last 2 or 3 days, instead of them coming back into the ER, getting admitted, getting IV diuresis, going in, staying here for a couple of days, potentially getting exposed to C. diff, I could just increase their Lasix or give them an extra dose. So that's the beauty of artificial intelligence, specifically in the home space, is that we really try to keep length of stay down in the hospital and decrease those readmissions on some of these patients that we know are frequent admitters in our emergency rooms. Open evidence. I can't say enough good about this. You probably have this on your phone, but if you don't, download it. It is free. The only thing you need is an NPI number to put in here, and you all have that. So Open Evidence is a physician-only artificial intelligence search engine that delivers peer-reviewed guidelines. It goes through all of the medical journals that we use. It is absolutely amazing. So I can put into Open Evidence without patient personal information, that I could say I have a 42-year-old man who comes in with a hemoglobin of 10, has been taking NSAIDs. Clearly, I already know my differential is going to be, potential peptic ulcer disease. But what's beautiful about Open Evidence, it'll pull literature from different sources and pull that in and give you a very detailed explanation of what you should be thinking of. Think of something like H. pylori. If you've got somebody with a positive stool test for H. pylori, you can't remember what the guidelines suggest. It's okay, just put in Open Evidence. What's the updated guidelines for H. pylori treatment? Within 10 seconds, you will have the quadruple therapy guidelines, and it will demonstrate what source it's pulled that information from. So a very, very powerful tool for physicians. This is one that you have to have. It'll save you so much time, and it really helps with outcomes of our patients because it is, again, pulling from peer review sources. So you can always use those in your documentation. There'll be a hyperlink. It'll say where it comes from. So it protects you, and it also gives our patients an advantage of getting them the right treatment. So it absolutely improves outcomes. I talked a little bit about medical scribe software. This really is a game changer in our environment, both in the clinic and the hospital. It really allows us to focus more on patients and less on the administrative burden of typing. Generative AI and documentation, again, tools that can generate SOAP notes or behavioral health notes using speech transcription. Again, these use large language models. Things like DAX, Nuance will help you with that as well. So I've given you a couple different platforms that we use, and they're all artificial intelligence platforms. And I want to just reiterate why this is so important for us as physicians. Without these tools, the burnout in our field of work is incredibly high, because of what I showed you. The population is aging, the workforce is shrinking, so we have to think, how do we leverage tools to help deliver care to our patients? We can use APPs, which is great, but at the end of the day, there's only a certain amount of APPs that can help us as well. So the real reason we need to leverage these tools, embrace them, understand them, and be comfortable with them is because the administrative burden is increasing for us, okay? The patient volume and the complexity of our patients are also increasing. Being on your laptop on vacation time with your family is a problem, and that leads to burnout, divorce. Just know that artificial intelligence, it will augment, but it will not replace us, right? So I just want to recap. This is really important to make sure you understand the why behind us leveraging artificial intelligence. So here's a couple free and easy tools. I've mentioned a couple of these. If you haven't used ChatGPT, it's amazing. You can also use Gemini. You can use Claude.ai, Perplexity, all great engines that will help you pull together. You can put in, construct me a consult note, and give all the details that you're looking for. Construct for me discharge instructions, construct for me, a prior authorization. All these tools will do that for you. It's pretty crazy. If you're using chest x-rays, ChecksNet is very good. Will help you identify nodules that you may have missed. Open Evidence, I talked about. PubMed is also really good. ChatGPT. So these are all just free tools that you can download on your phone and use. So ChatGPT, it's amazing. So you input, you can make a brief H&P. It'll produce a SOAP note. You could say, draft a SOAP note for a 62-year-old male with CHF exacerbation. It will do that. You can also ask for a discharge summary on a particular disease state, generate patient education. Somebody is going home, they're not really sure what to do with their blood thinners. You can use ChatGPT to construct that and say, you know what, this patient speaks Spanish, do it in Spanish, and it will do that. So leverage the tools, they're there for you. And then chat, there's the web address, so chat.openai.com. Again, so there's the website. You can click on that hyperlink and download it. You can also use Perplexity. There's an app you can put on your phone as well. Both of these are available. You can use web or you can pull them onto your phone. They're both fantastic. So workflow optimization. So artificial intelligence can help us with to-do lists just outside of patient care. If you're someone like me and I need every day a to-do list, I don't write things down anymore because I lose the paper. So I typically use Microsoft Outlook. I'll go into the task generator and I constantly update my task in there. But that's what we can do with AI. There should be no reason for you to bring a pen and a pad of paper around documenting anything. This could all be done electronically and saved to the cloud. Let's see. Let's talk briefly about caveats and ethics and safety. So number one, do not put any personal patient information into any of these tools. Just don't do it. You will risk losing your job. It is a HIPAA violation, so leave the patient details out of it. Can you say 62-year-old man? Absolutely. But don't put the patient's name, their date of birth, their SSN, nothing like that. Remember that AI is not the decision maker. You are going to medical school. You are going to be a physician. You are the person in charge. The AI there is only there to help augment and supplement information and make you smarter. But ultimately, your signature is on that note. You are the person responsible. So please make sure whenever you're using any of these tools to make sure you review them and make sure it's accurate. And then make sure the alignment with hospital, that you have, whatever you're using, that it's aligned with hospital compliance policies. And again, AI is your co-pilot, you're the captain. Free links, I've already given these. There's the websites for this, but ChatGPT, Open Evidence, and Perplexity, all free, I use all the time. I also use Gemini, but all these are free. So if you haven't subscribed to New England Journal of Medicine AI, it's super cool. There's a podcast that's free. And then also you can get the email that comes in once a week. And this is just amazing. It's all medicine focused artificial intelligence tools that we can use in our field to help us become better physicians and improve patient outcomes. Super cool. And you know, obviously talking about what's trending, what's new. So if you haven't subscribed to this, it's totally free. It's awesome. It comes into your email once a week, and then the podcast is super awesome. So a couple final thoughts. One, collaborate and innovate. So collaborate between your colleagues at the hospital, your IT professionals, your CMIOs like myself, and any experts in the field of AI. It's really, really important for us to drive innovation in healthcare. By working together, we can definitely develop more innovative solutions that really, at the end of the day, we're looking to improve outcomes of our patients and improve the efficiency of our work so that we can go home, have time with our families, and not get burned out, okay? If I'm not burned out and I'm staying healthy, then I can give back more to my patients. And then I would really strongly urge you to advocate for any AI adoption. If you have any folks around you that are either naysayers or skeptical, you know, try to offer them some of your learning experience. Any success stories that you have, I think will help. The more that we use these tools, I think the bias against them will continue to shrink. So make sure that you're advocating for these tools. If it works for you, share the love. Final thoughts: AI is not going to replace us. However, any physicians who don't use AI are 100% going to get outpaced by those that do. So just remember that. Explore. These are cool tools. Experiment, evaluate, find something that works good for you. All right. And then I'd say if you're just starting at this, start small. You know, download one app. Start, you know, with a small task per week, and then move forward. So a couple last points. One, AI will give time back to patients by giving time back to the caregivers. Right. Two, artificial intelligence will become the front door to healthcare. It already is. Three, artificial intelligence will help patients get the right care in the right setting. Four, trust in artificial intelligence will grow through families and caregivers, but we have to do that. We have to advocate for it. And then lastly, I'll tell you that artificial intelligence success will depend on fixing workflows first. These are some references. My last slide is Dr. Topol. He is a cardiologist, and I love this quote. He's got a book called Deep Medicine, and he says the greatest opportunity offered by artificial intelligence is not reducing errors or workloads or even curing cancer. It is the opportunity to restore the precious and time-honored connection and trust, the human touch, between patients and doctors. And I will tell you that artificial intelligence can't replace the human touch. So it can take the administrative task away from me so that I can then touch my patient again. So that is why it's so important to embrace it. All right. My email address is here. Any questions you have, feel free to reach out to me. You also have Kara's email. So I'm hoping that you found this beneficial, and good luck in your endeavors. And hopefully I will get a chance to meet you at our ACOI conference coming up in October. If not this year, then the following year. Thank you.